here. So we're going to move on and we're going to talk about the lead evaluation. I'm really excited to moderate on this one. And we've got Mary and Megan and Chief Reed Bear and Allison on the call. So I just want to kind of open up and just talk a little bit about how we got here. So as public safety agencies have been working to respond to the opioid crisis for probably at least over a decade, utilizing community-based strategies. We've really seen them bring their A game to the table and really try to develop innovative responses. And many of these responses involve the community at heart. And it started, even with something as simple as Operation Medicine Drop. And what we see today, all these years later, is more behavioral health partnerships between law enforcement agencies. And that could be found in the form of diversion and deflection programs, which are really rooted in community. And so here in North Carolina, about 7 years ago, actually more than 7 years ago, we really started to see an expansion of diversion and deflection sites and these behavioral health partnerships across the state. And you could have seen them as angel initiatives, pre-arrest diversion, deflection, PARI initiatives. And so that's really helped connect law enforcement and people who use drugs and have different interactions in the community during drug-related calls for service. And so with many new and innovative strategies, law enforcement leaders are always asking, does it work? What is the data behind this new innovative strategy? And so we wanted to answer these questions. And some of the questions are, what happens when we provide officers the tools that they can utilize different responses out in the community? And what happens to the police community bonds when these new strategies are used and individuals are given other options than traditional ones such as arrest? And what happens when we connect people who are struggling with their substance use and we connect them to people who are peer support, who can offer them harm reduction strategies and that critical in the field support? And this engagement with multidisciplinary teams, how does that affect our approaches between public health, behavioral health, and harm reduction strategies, and whether or not that can impact recidivism? So I am super excited to have this panel here today. Several years ago, Duke University took on doing this multi-year evaluation. North Carolina Harm Reduction had been working tirelessly around the state of North Carolina for many, many years, trying to work with law enforcement to improve these interactions with individuals who have substance use disorder. And so this multi-site, multi-year evaluation has now been finalized, and I'm really happy to have Dr. Allison Gilbert from Duke University School of Medicine and Rhea Siegel, who was the research coordinator for the initiative, Megan Moore from the Wilson Center for Science and Justice at Duke Law, and then Chief Reed Bear from Hickory Police Department. And then also we have Mary, who is also she's actually a peer support specialist at Coastal Horizons, and she's actually been personally impacted by the LEAD program, so we're going to hear her story. So first, we're just going to go ahead and kick off and have Dr. Gilbert open it up and talk about her evaluation findings for the LEAD sites.
Great, thanks so much, Melissa. I hope you can hear me. Yes?
Yes.
Great. I will go ahead and see. Here we go. And I hope you all can see this in presentation format. Great. Yeah, so thanks again, Melissa, and it's so wonderful, and I'm so grateful to have the opportunity to share our work with you all who are attending today. I'm also just very honored to have been able to work with you and Chief Bear and our team here at Duke and our other partners in this LEAD evaluation. So just a quick overview of what we'll be presenting today. I'll give a little bit of background on LEAD in North Carolina, and Melissa has already done some of that. I'll give an overview of the multi-site evaluation that we've conducted here at Duke. I'll go over some summary, kind of brief summaries of our findings, and we'll do that with Rhea Siegel. We'll then talk about, Megan will talk about policy implications and recommendations that we developed based on our evaluation findings, and then talk a little bit about our dissemination of the study findings and products that are publicly available that we'd be really pleased to distribute to any of you all who are here today that are interested in reading those. So just quick first shout out to our evaluation team. We've had so many people involved in the work over the course of what's now been 4 years. We started the evaluation in 2019, and we continue to do analysis, product development, publications on the work. And so you can just see here that there were many people involved and lots of committed and talented folks. So just a quick overview of what LEAD is, Law Enforcement Assisted Diversion. It is a pre-arrest criminal justice diversion program that aims to connect people in our communities who use drugs and are at risk of being charged with low-level criminal offenses that are often engaged in to be able to sustain drug use. The program aims to, in lieu of arrest and to break the cycle of arrest and incarceration, connect people to a range of services and supports, and ideally divert them away from the criminal justice system. And so the way this works is law enforcement officers who are often regularly encountering these individuals in the community can assess eligibility for connection to the program. If the individual is eligible, the law enforcement officer can use their discretion to refer the individual to LEAD in lieu of arrest. That would be what we describe as an arrest diversion. There are also opportunities for officers to make social referrals or social contact referrals. And those are instances in which an officer may encounter an individual in the community who they know uses drugs, they think could really benefit from program services, and maybe they've encountered them and are interacting with them at a time when there is no criminal activity taking place, but take that opportunity to refer the individual to the program in any case. At that point, once the referral is made, in ideal circumstances, there's a warm handoff from the officer to a LEAD staff person who's often a case manager based in a community case management agency. The individual then goes with the case manager to the agency for a comprehensive intake assessment. At that time, they discuss what the individual wants and needs in terms of resources, services, supports, and the case manager then works to connect the individual to those services and resources. And there's also often a lot of field-based outreach that's done really to help check in and support on individuals that are engaged with the program. So currently there are 6 active programs in North Carolina. I included Orange County here. They don't have a traditional LEAD diversion model, but do have several diversion programs as well. The LEAD was originally developed, the model, in Seattle in 2011. Since then, it's diffused pretty widely around the country. And North Carolina has really been a pioneering state in the southeastern region of the US in implementing LEAD. And that's in large part due to a really strong and special collaboration between law enforcement leaders around the state and North Carolina Harm Reduction Coalition. Melissa was a primary lead in helping jurisdictions around the state implement LEAD and other harm reduction initiative and approaches. So in North Carolina, the first program that started was in Fayetteville, and that was in 2016, again in partnership, implementing in partnership with North Carolina Harm Reduction Coalition. And then Chief Bayer's program into Catawba County in Hickory was implemented in 2018. So we have boxes here around the 4 sites that were involved in our evaluation of LEAD in North Carolina. So that included Wilmington, Fayetteville, Catawba County, and Waynesville. So there were a lot of factors that went into consideration in terms of identifying study sites. You can see that with these 4 sites that we have a nice representation of across North Carolina, including both urban and rural mix. Staff capacity was certainly a factor too, and that included the police departments we were involved with, having crime analysts that would be able to coordinate with us to share criminal justice data for program participants. We also thought about the number of active sites at the time that we were implementing and starting our evaluation, and those sites having been operating long enough to be able to do good pre-post participation analysis for participants in the program. So again, this was really a strong partnership throughout the 3 and 4 years and continued work on the evaluation between Duke University School of Medicine, the Wilson Center for Science and Justice, North Carolina Harm Reduction Coalition, and now RTI. And funders for the work were the Duke Endowment and the Wilson Center for Science and Justice here at Duke Law. So this will give just an overview of the scope of work that went into the evaluation. We took a mixed methods approach to the study, so collecting both quantitative and qualitative data. We did both outcomes and process evaluations. And for both of those, again, we used that mixed methods approach where we analyzed administrative records to estimate outcomes for program participants in their association with program participation and primary outcomes of interest. And then had a lot of rich qualitative data that went along with that, both that informed outcomes and program processes and features of implementation. So over the course of those 3 years, we collected the following data across our 4 evaluation sites. We did 22 interviews with lead participants themselves, which included some structured survey content and open-ended interview questions. We have 27 in-depth stakeholder interviews with program partners. So that included case managers, outreach workers, lead law enforcement coordinators, district attorneys, office representatives, and clinical supervisors. We then did 4 focus groups with law enforcement officers who were participating in the program and making referrals. And then we were able to collect a wide range of administrative data for 244 people who had participated in the program across these 4 sites. Those administrative data include criminal justice data, namely criminal citations, arrests, incarcerations. We collected behavioral healthcare service utilization data from managed care organizations in each of the 4 jurisdictions, and also a range of program data. So that included, say, case management notes, notes taken during case staffings, which at each of the sites were typically bi-weekly meetings with program partners that were involved in programming and making referrals. So I'll go over just really briefly some of our findings as it relates to associations between program participation and citation and arrest rates among program participants. So what we were able to do here is use statistical analyses to estimate the difference between citation and arrest rates in a period of time before people became involved with the program and had been referred to the program, and then looking at the same period of time following having been referred to the program. And what we found here was that having been involved and well engaged with the program was associated with arrest rates that were 2 times lower in the 6 months after having been referred as compared to the 6 months before having been referred. So this was the observed arrest rate in the 6 months before people had been referred to lead, and here it is in the 6 months following. We were also able to construct comparison groups, identifying people who had lead eligible arrests in the jurisdiction in the same window of observation, but who were not referred to and enrolled in lead. And with that group of people could estimate what we would have expected participants' arrest rates to be if they had not enrolled in and gotten well engaged with the program. And we saw here too that the expected arrest rate would have been 2 times higher than what we observed after people got engaged with the program. We also looked across like a wide range of program data, services that participants expressed interest in at their intake assessments and being connected to. And then we're able to look also at actual service engagement among those participants sometime during their program participation. And you can see here, there was strong interest. So the LEAD model really is grounded in harm reduction philosophy. There is no treatment expectation imposed on participants. But what was interesting is that the majority of participants did express interest in being connected to substance use treatment services. So close to 70% expressing interest in that, and about 70% also then went on to be connected to substance use treatment services sometime during program participation. The same went for mental health services. More than half expressed interest in being connected to mental health services of some kind, and nearly 50% did end up getting connected to mental health care. There was also a lot of strong interest expressed in getting connected to employment assistance and housing assistance. We saw less service connection being made there. I think that is in large part a reflection of employment and housing resources being scarce, both across the state of North Carolina and nationally, and also especially difficult for connecting people to both employment and housing that have criminal histories. So now I'll switch over to Ria, and she'll go over our process evaluation findings with some highlights there.
Okay, thanks, Allison. So yeah, I'm going to share, Allison was kind of sharing how the program has impacted the people who are involved in it. Now I'm going to share some details about what was working well with the program, what could be improved. So the trends you see on this slide here were true of all the sites individually, but these numbers here represent the pooled data. So we did see similar trends across the 4 sites. So we see that officers were making significantly more social referrals, 70%, compared to arrest diversions, with only 30% of referrals being arrest diversions. So that means there were more referrals being made to the program when an officer encountered an individual who was not engaging in activity that would otherwise be criminalized. And we also found that the participants and the people referred were disproportionately female and disproportionately white, compared to the demographics of people in the community who were charged with drug charges that were eligible for lead diversion. So we had a data set that outlined all the drug charges in the county that would have been eligible for lead diversion. So we compared that data with the participants who were in the LEAD program. A caveat with that data is that while the charges were eligible for diversion, we don't know if the people who received those charges would have otherwise been eligible for diversion based on their criminal history. But either way, these numbers are definitely worth looking into more. The last point here on this slide is that only 50% of people referred to LEAD went on to actually enroll in the program, meaning that a lot of people that got referred showed interest at the time that they were interacting with the officer, but didn't actually follow up for the intake assessment to engage with the LEAD staff. So you go to the next slide. So we made these maps. They might be a little hard to see, but we made these maps for all the 4 sites to kind of look at where referrals to LEAD were happening, which are the yellow stars there, compared to where people who are being charged with those LEAD eligible drug charges I described on the previous slide, where those charges are happening, which are the red triangles. And then we also looked at where the rates of overdose deaths were highest in the various parts of the city or county. So this here is a map of Hickory that we made for the Catawba program. And you can see that the referrals and LEAD eligible drug arrests are concentrated actually in similar areas of the city, which was kind of neat. For Hickory, there isn't anything meaningful we can really deduce from the drug overdose deaths, since there isn't, you can see here the rate is the same across the city by that consistent color, but for other sites that was more relevant. And in general, we were told by the sites that these maps were helpful in thinking about where they might want to target referrals and what areas of their city or county need more outreach for LEAD. So we just wanted to show you that map because the sites found it really helpful. You can go to the next slide. So a major part of our process evaluation was identifying facilitators and barriers to successful implementation of the program, for various aspects of the program, and we used qualitative data to come up with those barriers and facilitators. And this slide explains the facilitators and barriers to one aspect of the program, which is referrals and enrollments, which we thought was most relevant to this symposium. But we do have facilitators and barriers to all different aspects of the program, which you can find in our report and other resources. So looking at the facilitators to referrals and enrollments, we found that a culture of support for LEAD in the law enforcement agencies involved in the programs improved officer buy-in for the program, which might seem kind of obvious, but it was nice to see that in the findings. And more explicitly, support for LEAD in higher ranks of the department seemed to increase support for LEAD among frontline officers who were tasked with actually making the LEAD referrals. We also found that if there is a successful warm handoff, which Allison described what a warm handoff was, but basically when a LEAD staff member meets the law enforcement officer and potential LEAD participant at the time of the referral, if that warm handoff actually happens, there may be increased likelihood that the individual will actually go on to enroll, which helps with which could be helpful for some of that problem that I mentioned on the earlier slide, which is that half the people who are referred to LEAD actually don't go on to enroll. So perhaps warm handoffs, more consistent warm handoffs, is a good solution to consider for that problem. The last facilitator here is that we heard from stakeholders and LEAD participants that allowing LEAD referrals to be initiated by community members rather than just by law enforcement, meaning that somebody in the community, it could be a mom, it could be a LEAD staff member, or another LEAD participant, can make the referral rather than just law enforcement. That being able to have that feature of the program extended the reach of the program. And 3 of the 4 programs we studied had that option available at the time of the evaluation, and the 4th was interested in adding that component to the program. So moving on to barriers to referrals and enrollments, we heard from law enforcement officers at every single site that they wish that the eligibility requirements were more relaxed, because they often encountered people who might benefit from LEAD, but who they couldn't refer because of criminal history or probation status. And so the inability to refer people they wanted to really prevented the number of referrals that were made to the program. We also heard from participants, law enforcement, program partners, everybody we interviewed, that a barrier to participants accepting LEAD when they were offered a referral by law enforcement is general mistrust in law enforcement and not wanting to be a part of a program that is connected to law enforcement based on past experiences with law enforcement or past experiences of people in their community with law enforcement. So those community initiated referrals that I mentioned in the facilitator section help with that problem. And finally, probably the biggest barrier we heard about for referrals and subsequent enrollments was that many officers just don't buy into the idea of LEAD and thus don't want to use it. And also, kind of interestingly, that some officers aren't even aware that the program exists. So there's that combination of a lack of buy-in, a lack of awareness that just leads to a decreased number of referrals than the program would like. So you can go to the next slide. So since officer buy-in was a barrier that we knew about from other studies that were done about LEAD programs across the country, we focused a lot of time in our interviews and focus groups with officers on officer buy-in and the factors that increase it and hinder it. And we have several takeaways about buy-in that are very well detailed in our report, but a couple that stand out here I have outlined on this slide that we want to share with you today, which is, the first is that an understanding of the value of harm reduction increases an officer's likelihood to want to use LEAD. And this officer here explains the theme well. I'll read it out loud. He says, "My chief took me from basically the SWAT team commander fighting the war on drugs to giving me 2 projects back to back, naloxone and LEAD, where I had to understand harm reduction." He says, "You aren't just educated on the program, you have to be educated on harm reduction in a way where you understand the nature of substance use disorder and relapse and recovery, and appreciating the different stages that people are in." So we heard from law enforcement that embracing harm reduction takes time for officers, as this officer described, and repeated trainings to increase education about harm reduction could increase buy-in for LEAD more generally. The other theme highlighted here are that many officers shared that they didn't buy into LEAD until they saw that the program really worked firsthand. And, you know, they heard the statistics when the program was brought to the department, but until they saw it for themselves, it was harder for them to buy in. So this officer shares that sentiment, and he says, "I'll be honest, I didn't buy in immediately, but I saw it worked. So the best evidence is actually seeing it for yourself." And you go to the next slide. So finally, I just want to highlight with this slide related to our process evaluation that while the people we interviewed and did the focus groups with did mention a lot of things they would like to see change with the program or barriers to the program's success, they also acknowledged a deep appreciation for the program, and that was really consistent across all of the people we interviewed. And we saw that part of that appreciation is that they really understood the capacity that LEAD has to impact LEAD participants, program partners, the people who are involved in implementing LEAD, and the community more generally. Some people felt like LEAD has the capacity to do that, but isn't quite meeting that mark yet based on the number of people who are enrolled in the program. And other people felt like that impact was definitely present, even in a small way or in a large way. So here's a quotation about the impact LEAD has on participants from a very appreciative participant. And this type of sentiment we hear from this participant was pretty common among the 22 participants we interviewed, just like a lot of appreciation and a lot of gratitude towards the program. So this person says, "Without LEAD, I wouldn't be where I'm at today, hands down. I mean, it's a vital part of what got me clean, got me off the street, got my kids back in my home, and made me feel like I'm doing what I need to contribute and be a better person." And there are two other quotes on here that I don't have a lot of time to read, but they explain the ways that the program partners and community have also been impacted by LEAD. You could just take a moment to skim them. Yeah, and that's all I have. You can go to the next slide and I'll pass it to Megan.
Thanks, Ria.
Thank you. We see now as a really great opportunity to expand LEAD programs across the country. As part of a settlement agreement announced in 2022, states and localities will receive $26 billion over a period of 18 years. In North Carolina, we will receive $750 million, and 85% of this will be going to counties and municipalities. Under the terms of the agreement, the majority of these funds are to be spent on opioid treatment and prevention programs, and that specifically includes evidence-based criminal justice diversion programs such as LEAD. So this settlement and other smaller opioid settlements that have been announced are an opportunity to expand the adoption of LEAD programs, and we have the goal of improving the outcomes and strengthening the impact of the programs based on some of the findings from the evaluation that we've discussed. Next slide, please. So one recommendation we have for optimizing the LEAD programs is when structuring the program leaders should explicitly address racial equity considerations in program policies and procedures. As was mentioned, there was a disparity in the people who were referred based on potential eligibility for the LEAD programs. And this need to consider racial equity is echoed by some state level opioid and substance use plans. So for instance, in North Carolina, the Opioid and Substance Use Action Plan 3.0 is centered around equity in implementing programs that reduce harm to historically marginalized people. So some ways you can go about this are improve outreach to communities of color and engage community members actively in creating the program plan. Strategies to reduce racial inequities in arrests and LEAD referrals should also be considered. And trainings and communications about LEAD should address racial equity and advise stakeholders on the kind of strategies you can use to advance racial equity in this work. As mentioned, holding regular officer trainings grounded in harm reduction principles to increase program awareness and buy-in is really important. Stakeholders from all 4 sites reported wanting better awareness and buy-in from law enforcement officers. And some officers themselves also reported confusion on the LEAD program, its requirements and expectations. As you're creating your program, initial trainer options could include looking to other lead programs and using already trained lead officers that have experience in other sites. And also the National Lead Support Bureau has resources. Another recommendation is expanding the eligibility requirements to be as inclusive as possible of people who use drugs and could benefit from the program services. During the evaluation, many stakeholders reported wanting more inclusive eligibility requirements, and it's possible that these restrictive eligibility requirements contributed to the racial disparities in referrals and enrollments. Some specific examples of potential changes that could be considered would be allowing individuals on supervised probation to participate in the program, or reducing the look back period for prior disqualifying convictions. Next slide, please. Programs should also aim for warm handoffs from law enforcement to lead staff after every referral to increase the rate of enrollment. This is particularly important because the evaluation found that participants were more likely to engage in the program when there was a warm handoff from police to program staff. Something communities could consider is using these opioid settlement funds to allow for lead case managers or lead affiliated mobile crisis staff to take referrals at all hours rather than just during business hours. Another important recommendation is to systematically track demographic data on referrals. This includes individuals who are considered for referral but deemed ineligible, and also those individuals who are eligible for referral but were not actually referred to the lead program. This kind of robust data collection is essential to understanding how well your program is working and allows your program to identify and fix potential gaps in the referral and enrollment process. For instance, you could collect this data, find a gap, and consider modifying your eligibility requirements or conduct additional training to fix these identified gaps. Another recommendation is encouraging and strengthening participant and community engagement. The evaluation showed that consistent engagement with lead staff was associated with better outcomes for the participants. Some strategies to increase the likelihood of higher engagement would be establishing maximum caseloads for lead staff so they have more time to engage with participants, and also engaging with already active community organizations to maximize support services available to the lead participants. Another strategy would be to staff a full-time program manager that could provide consistent implementation of the program administration activities and reduce some of the engagement barriers we identified during our evaluation. Another example would be to consider providing additional services and support to the participants. The evaluation found that lack of reliable access to phone service was a major barrier for some participants. So it could be an option to provide cell phone services to participants to encourage this higher level of engagement. And next slide.
Great, thank you, Megan. So this is our last slide, and just wrapping up, we produced a set of reports based on our evaluation work and findings that are publicly available that we'd love to share with any of you who are interested. I can put a link to these reports in the chat. They include a 4-page brief report that is easily accessible and a quick read for people who are interested but maybe don't have a lot of time to go in depth. We do have also a full-length report that's pushing 100 pages that gets into much more detail about our findings and our study approaches. We've got a 7-page policy brief that could be really useful for policymakers and their staff when thinking about, and county commissioners say, if they're giving consideration to implementing a program like this, including, potentially as a way of spending some of their opioid settlement funds. And then we've also got a report that we put together that details recommendations for active lead programs or jurisdictions that are preparing for implementing a program, recommendations for data tracking within their program in real time so that they can do self-evaluation of how their programs are operating, including related to referrals and enrollments, and that they can shape operations, policies, and program practices from there. So that is all from us, and I'll give it back to you, Melissa. Thanks again for this opportunity.
Thank you so much. Really appreciate it. And when we were talking about some of the officer buy-in challenges that so many of the lead sites or even just diversion and deflection across the country face, RTI was able to develop I think it's a 1 or a 2 pager. It's actually on our website. And what we did is we provided some recommendations on how you can work inside your police department to make sure that your officers have the training and whether it's harm reduction or understanding policies and procedures connected to the LEAD program, just some of those buy-in strategies that we found across sites that were really helpful. So I recommend that you guys check that out. Chief Bear, are you ready for some Q&A about Hickory Police Department's project?
Absolutely.
All right. Well, congratulations first on your chief appointment. I know that you will do well for the citizens of Hickory and the officers there. So as Dr. Gilbert mentioned, you guys started your LEAD program in 2018. And so can you describe what was going on in your community during that time frame that kind of gave you guys this opportunity to explore pre-arrest diversion programs, and specifically one that's rooted in harm reduction?
Sure. So we were seeing a lot of the similar things that a lot of communities were seeing 2016 and 17 with a pretty steep increase in overdoses. We were seeing things back on the street, such as heroin, that we had not seen in a very long time. These were things that I had seen in the beginning of my career in the 90s and then was reappearing. It had been gone for quite a while. So the overdoses were very concerning. We were having people fatal overdoses, and we were having a lot of other residual issues from the systemic issues of the overdoses and the dealing of heroin. So we were looking for alternatives to just arresting. We found that we were having individuals that our officers were encountering over and over and over again. And they were using drugs, and they would be charged appropriately with the tool of arrest or charge. And then they would be either right back out on the street, or it was almost a revolving door. If they were going to jail, there was no help there. So when they came out, there was the same situation that they had going in. And so we started to look at alternatives, and we wanted to give our officers a tool to address these issues that they were seeing on the street. And we look at ourselves as problem solvers, which I think probably most police departments do. We like to use the term law enforcement, but we're actually policing. And when part of policing is problem solving. And so we wanted to give our officers a tool. And so we started looking at a lot of these programs. You alluded to one earlier, I think, when you were talking about the Angel program. There's a lot of faith-based programs. There's several out there that work for specific communities. And so we were trying to find something that matched up with the way we police in Catawba County, specifically the city of Hickory, and also match up with our community policing philosophy. And we heard about LEAD. We started doing some research. At the time, Fayetteville already had their program. And so we took a trip to Fayetteville to really kind of dig in and see what LEAD was all about. That's when we learned about it being rooted in harm reduction. And we just felt that model, we just felt that model was a good fit for how we police in Hickory, North Carolina. That meeting people where they are and trying to get someone into help as quickly as possible with that warm handoff you were talking about earlier. We just kind of had a gut feeling, for lack of a better word, that was the best way to go about it. And we felt like that was with the individuals that we were interacting with, that would work for them. And we're very fortunate enough to have a crime analyst here at our department. And so we started pulling arrests that we saw were what we had found out through interviews and knowing the members of our community. These arrests were things such as shoplifting and larceny. We had a lot of property crime, and we found that it was related to a drug addiction. And so we started to take these names and we started to crunch the data, and we found that if you took a pool of certain community members that we were dealing with in this respect, and you multiplied out the number of charges they had accumulated, it accounted for quite a bit of your crime. And so we started to address that through, if we had something we could have offered these folks at that time, what could we have also prevented, and not only helping them get their life back on track, but also what could we have done to prevent the crime from happening, reducing the fear of crime and improving the quality of life. So that's how we got started. And as you mentioned, we got started in 2008, May of 2018.
Yeah, thank you, Chief. And in thinking about the evaluation findings, which points did your team find surprising? And were any points validated what you and your team had already been seeing when you were doing your case management or case staffing teams every other week? And was there anything surprising?
So as far as surprising, I think they were good surprises. I think we were surprised at the rate of social referral versus charge diversion. When we started the program, we were of the mindset that we had, I guess, because we had all had the charges in the past, because that's all we had. That was the only tool we had. And so when we saw that the significant number of social referrals far outnumbered the charge diversion, I think that was a surprise, but it was a good surprise because it told us that our officers were really excited to have a tool that they could try to help someone. For all the police on this call, every new cop, when they come in for an interview, will tell people, when you ask them, why are you applying for this job, is they want to help people. And I think we saw a resurgence of that attitude where I can help someone without the only tool of arrest. I now have another tool to try to help someone. So that was a surprise. And then I think although we kind of felt that it would work, I think the rate that you heard Allison talk about earlier, that they were not reoffending once engaged in the program, was also a surprise. That it was double. That was a great surprise as well, but if we're honest, I don't think we thought it was going to be that successful.
Yeah, thank you very much. And something to note is every time they do a case staffing, they're running criminal histories just so they can keep this data collection going on a consistent basis. And the last question I have for you, Chief Bear, at this time is, what do you think the most important or most impactful outcomes were for your department and for your community with your implementation of a pre-arrest diversion program?
That changes. It really does. I think initially, some of the most impactful things that we saw were that we had officers who had a new tool and they were excited to try to help someone. And I think the resurgence of that attitude, I think that, when you're trying to build a house, if all you have is a hammer as a tool, you're going to build a pretty sorry house. And so by giving officers more tools, they're able to, with all the problems that we're presented with, particularly over the last several years that had not traditionally been law enforcement issues, we have to have more tools and training in order to deal with these situations. So I think that was quite impactful for our police culture. I think that another impactful outcome has been seeing the individuals that have historically been interacting with us in a negative way. We've had some folks come to our case staffings that are in the program to talk about their success and what they're up to now. That's been really rewarding. That has really proved that what we thought was going to happen has been happening. And then I think also the partnership. So our lead program is not just Hickory Police Department, it is Catawba County. And one of the bigger impacts we've also seen is in partnerships. And so as more agencies heard about the program, started asking questions, our sheriff's office joined us. So now we're several agencies strong, and we have a very strong partnership with not only the law enforcement agencies in our county, but also the mental health and service providers, Catawba Valley Healthcare. I mean, I would be remiss if I did not say that they are the ones who do the heavy lifting. The police part of this is easy. It's a mindset, it's a culture, it's a understanding that there's other ways to help other than our traditional means, and then giving those opportunities to our officers. But the heavy lifting is done by the clinicians, by the case manager, and people like Mary, who is peer support. Peer support is so important. So I think and it just changes every day. There's just something that proves beneficial and impactful as you continue to program. Every case staffing I attend or am briefed on, it's just there's not a lot of negative, or if any, that has come out of this program.
Mm-hmm. Thank you, Chief. And you mentioned or alluded to earlier compassion fatigue amongst officers, and that's always going to be a challenge. And officers face this when they've been responding to the opioid crisis for so long. They see the same people again and again, and that really can breed some frustration. And we don't want that for officers. And so I think that the LEAD program offers an opportunity for you to make some impactful, decision-making that can really help guide someone towards treatment if they're ready. And so that's something that officers don't always have the privilege of, if you will, right? Sometimes they can go to Walmart and somebody may say, oh, do you remember me? You helped me 10 years ago. There's not enough of that to thank officers for what they do. And I think that the LEAD program gives them that opportunity because, as the chief said, they can come to a case staffing and they can sit in and they can go, hey, how's my referral doing? And they may not disclose confidential information or a lot of nitty gritty, but sometimes officers just need to know, we got your referral, we appreciate your referral, and they're doing really well. And so that's something that I think can be really helpful for the law enforcement community. So Mary, thank you for being here. You can hear? Yeah. Great. So I want to introduce Mary. Mary is a peer support specialist. She works with Coastal Horizons in Wilmington and New Hanover County in North Carolina. And Mary's going to talk to us about her time with the LEAD program.
Hey, good afternoon, everybody. You're gonna have to bear with me. I'm kind of under the weather. Been sick for the last couple of days, but made a commitment today. I get to show up. So my name is Mary Wormy. I am a certified peer support. Now I'm actually in Cumberland County. Our corporate office is in Wilmington. So I am in Fayetteville, and I also attend the LEAD meetings here as part of my routine as best as I can. So a little bit about my history is, I moved to Fayetteville, I think in 2012. I had been sober for about 4 years when I got here. I we'll just say I went down the wrong path again and went back into active addiction. And, my story is one, I had two parents. My mom was a deaf mute, so that was a little different. I think something that's real, you hear a lot in rooms where I attend for support. I never felt like I fit in, right? So I had a mom that was impaired, and I was a military brat, so I moved around a lot, and so I was just kind of all over the place. And I just never really felt like I fit anywhere. I'm one of 5 kids, and we all have a different dad. They were all military men. So I kind of ran by myself, and I excelled in athletes, being an athlete pretty much. And that's kind of what got me through my years. But then, getting into my 20s, what comes with sports is a lot of drinking. And so I followed my journey doing a lot of that, what I thought was just fun, 20-year-old kind of stuff. And then at some point in my life, I crossed that line, and it was no longer just partying and drinking and having fun with friends. I got introduced to narcotics and, cocaine specifically. And that took me down a very different path. And there were many, many attempts. It was really trying to get the pressure off my back. I used to say I'd have back pain, trying to get the family, the employer, friends and not off my back, and the legal system. I can tell you, I've been to rehab between outpatient and inpatient at least 40 times. I stopped counting, and that was my first treatment for substance use disorder. And let me just say, today I'm living in recovery from substance use disorder, but I also have some mental health that recently popped up. So I've got to work supportively to take care of both of those to maintain my well-being. Lost track there. So with getting introduced to drugs, I found I thought it was a way to cope, right? I'm not sure what I was running from at that time. It just became a lifestyle for me. And, after being sober for a few years and living a pretty good life, I knew that there was another way. And I couldn't figure out why I would relapse, right? I had never heard of harm reduction until I came to Fayetteville. And I tell you that within my job now, it makes all the difference in the world. Like coming from a harm reduction point stand, I don't have expectations of the folks that I work with, unlike I did on myself. Like I wanted myself to be clean and sober. And I was always just waiting for the other foot to drop because I had so many relapses, and I just thought I was one of those people that were just hopeless, quite honestly. You know, I started getting in some trouble here in Fayetteville. Not just DWIs, but, you know, paraphernalia charges and whatnot. Let's just say, I went from hanging out with jocks and preppy people to associating with people that I would probably not have anything to do with if I wasn't under the influence, for the most part. Who I was, who I became, I did not like. And I had been in and out of say support meetings, 12-step meetings and that kind of stuff. Never could really buy all in to it. And I ran into somebody that I knew from the rooms. And that person just happened to be previously working with harm reduction. And I told her, I ran into her, she said, "How you doing?" I said, "Great." She said, "You look like shit." And I said, "Oh, okay. Well, at least somebody got honest with me." But she told me about the LEAD program, and you know, she told me whenever I wanted to quit, you know, that she knew some people I could reach out to. And it was probably a week later that I had just found myself really feeling real hopeless. Like I didn't want to keep using, and I didn't know how to stop. I didn't know what else to do. And I was at that point where, you know, criminal activity, or at least being I was always the driver, you know, because I was too chicken to do anything like illegal. But I would carry around people to do criminal activity, and I just got tired, you know. I tell you, when you get sick and tired and you've had enough, you want some change. And at that point, I was pretty much suicidal, and just real hopeless. And what ended up happening for me is the last thing this person did was give me a number of a lead officer that was in town here in Fayetteville, and I reached out to him. And I told him my address, and at that time, I think I had a couple warrants, to be honest with you. I think I had a couple warrants. I'm not sure for what. But he picked me up and he brought me down to the office where the lead staff are, and did my assessment. And from there, you know, I spoke to them. They asked me what I thought I needed, and I said, I need long-term. I need long-term. I'm no longer a youth anymore, and I've been hitting it hard out here, and I just need to get saturated in a residential. And so I did. I went up to Wake County to the healing place, stayed there for a year, and ever so grateful. Like, you know, I didn't even know that place was a homeless shelter for the first month, right? I just thought I was in rehab. And then somebody broke it to me. I was actually living in a homeless shelter. And I'm like, what? Really? Oh, I didn't know that. I just thought it was treatment. But that program saved my life, and LEAD is how I got there, right? So LEAD has been a great experience for me. That's why I participate in it now. You know, and I actually will go out once in a while. I'm blessed to have the job that I have as peer support. So let me try to stay focused. So I go to rehab. I stay in Raleigh for 2 years in supportive living. I'm working out there, having a pretty, you know, meaningful life. Doing lots of volunteer work and giving back to the community as best I can. And then opportunity opens up. You know, I came down and I talked to Anna actually one day. I was frustrated about, you know, I've been sober 3 years, and I can't get this job over here at the county because of my background, and And about a month later, she emailed me and said, you know, we're looking for a certified peer support. Would you consider it? And I didn't know what that was. And so what I can tell you is about peer support, I think is so vital in so many areas, and we're seeing peer support pop up everywhere. But it's definitely a bonus. I get to link people now to resources that are on probation. I actually will if anybody in this building here, because we have pre-trial, sobriety court, probation, any of the officers come to me for any kind of resources, I go out of my way to give it to them. You know, there's a couple people even in diversion that I've been able to lead and direct to the right facilities, because we don't have much here. We have to go out of town for stuff. But today, you know, from a homeless shelter, I just purchased a house in November here in Fayetteville. So like, these are all the blessings because somebody took the time to listen to me in my assessment with LEAD. I'm still waiting for the privilege to thank the police officer. That was one of the positive interactions I've had with law enforcement, and I've now since had plenty since then. I tell you, I have not been in handcuffs again since I've been sober. That is such a blessing. I have not had to worry about warrants. I have not had to worry about any of that stuff. I've been given a life that I didn't know I could have. You know, and so I'm grateful for my job here. Grateful to be of assistance anywhere I can be of assistance. You know, I work closely with harm reduction because I believe in it, and that's pretty much it. Like LEAD, you know, not everybody I think I too, like, I've been living here for I don't know how long. I've known this individual. I had never heard of the LEAD program. Not ever heard of it. So I think, you know, I'm just thankful that she had heard of it and referred me to it, because it's changed my life. And that's pretty much what I got for short version.
Mary, thank you so much for sharing. I know it's not always easy to share your lived experience, your personal story, and I knew you would choke me up, and you certainly did. And I think there's a lot of people in the audience that were really grateful for your words and really inspired. So thank you so much for your support of the LEAD program and peer support and harm reduction. So I think we have some questions. Peyton, how are we doing? I know I'm standing between you and lunch, but maybe there's a couple.
Yes, we've had a ton of questions in the chat that Ray has responded to, so thank you so much. Are there any questions in the room?
Hi, thank you. I'm Cami Chavis from William & Mary Center for Criminal Justice Policy and Reform. And thank you all. This is a really, it's really educating for me to learn about this program. I am so concerned about the racial disparities, though, that you mentioned. And of course, they track everything else that we know about the criminal justice system, from arrest to conviction to sentencing. And I appreciate the recommendations, but I really do wonder about law enforcement and the ability to implement those recommendations. So I would ask anyone, but maybe particularly the chief, of like, how can you get your officers to understand that these disparities, and perhaps it's implicit bias, but there may be explicit bias. And so just want to talk a little bit more about that.
Sure, I'll be happy to address some. So when we looked at ours, and I know that the study had several programs in it, when we say referral, we actually refer everyone. So referral, we fill out, and the person has to accept the referral before they actually go into the program. And so with regard to not offering or not referring, I can only speak for LEAD Catawba, but we did not identify that issue. Every single person that is eligible, and then the eligibility may be something to talk about, because we do have criteria for, as Allison mentioned, the criminal history of who we can refer. And for us, and it's different for every LEAD site, typically it centers around any kind of violent crime in the last 10 years. And it's because for us, it's because we're doing a warm handoff to a civilian clinician. And so at that point, during the process of planning for our program, when we sat down with our partners, that was a valid concern that they had with regard to who were the individuals we were calling and saying, here, this person is someone who needs to come to this program. And so that was our decision here. And that is certainly not relevant or true for every single program. But I can talk about the referrals. In Hickory, North Carolina, we refer everyone who is eligible, regardless of gender or race or anything of that nature.
Can I make a brief comment about that? Seattle, we didn't mention this in the presentation, but the Seattle LEAD program has actually moved towards allowing law enforcement referrals, but also really emphasizing those community initiated referrals that I spoke about because of this issue of biases that officers may be bringing to the referral process, as well as other factors. So that is an avenue to explore with future LEAD programs as well, is allowing multiple forms of referral so that more people can benefit from the LEAD program more generally.
And if I can add one more comment, the other thing that we were tracking now is, when we offer the program, if a person does not accept it, then they are not referred. And so then the question becomes, well, how do you perhaps get someone who's not trusting law enforcement to want to accept the program from law enforcement? And that speaks to what I think Rhea is talking about with the community referrals, which we also do that as well, depending on, I think it probably depends on the community and the agency on how they do it. But a community member can come to our program and say, hey, I have a person. Obviously, there's still a law enforcement element because we have the contact with the clinicians. So we would have to work through that piece. But I think addressing the criminal history issue and the trusting of law enforcement based on history, I think are probably things that we address. And one of the things that one of the ways we address it is through our community policing initiatives and getting into neighborhoods and sitting down with community members face to face and having community meetings and talking about how communities want to be policed and how they can participate in that policing of the community. It's a real conversation that we've been very fortunate enough to have in Hickory since 1993, when a couple of chiefs ago who instituted that department-wide. I think those kinds of initiatives, those kinds of cultural shifts of what we're seeing today will lead to these discrepancies changing in the future.
Thank you, guys. Any other questions from the audience? All right.
All right. Thank you so much to all of our presenters today. I really appreciate your time and everyone who's on Zoom and in the audience. Lunchtime.
Thank you.
Thank you guys so much. We'll come back at 1:30. Lunch